Hi fam, this is me again today. Hope you're doing well today. I just want to quickly drop like a few tips on how to maintain your milk supply. So this video is just going to be brief, just a few tips on how to maintain your milk supply. Okay, the number one on my list today is frequent feeding. Maintaining your milk supply involves a combination of frequent breastfeeding, proper latch positioning, and self-care. They all work together, okay, in order to help you maintain your milk supply. So when we talk about frequent feeding, nurse your baby often, at least 8 to 12 times in a 24-hour period. Yes, take your eyes off the clock and put your eyes on your baby. I personally promote feeding on demand, not feeding by the clock. So try to figure out the signs your baby gives you when they are hungry, like when they are rooting, turning their eyes, smacking their lip, and just before they get so hungry that they start crying, you try to put them to rest. Okay, the second on my list is proper latch. Yes, a proper latch is a key to good milk supply, because when your baby is properly latched, there is proper milk transfer. So your child will be getting enough milk because they are latched properly. You, the mother, will be comfortable to stay as long as the baby needs to feed, because you're not in pain, you're not experiencing nipple cracking, you're not experiencing nipple bleeding. So you're comfortable to stay with your baby for as long as your baby wants to be on the breast. Now, how do you know your baby is properly latched? Most of your areola should be in your baby's mouth, and your baby's mouth should be flanged out like a fish mouth, okay? And then you should hear the swallowing sound when your baby is drinking, is sucking. You should hear that swallowing sound, because when you talk about baby sucking on the breast, the baby doesn't suck on the breast the way we think. Like no, they don't suck with the lip. It's the palate. So when they're properly latched, when your nipple and most of your areola is in the baby's mouth, they are able to So how do you know your baby is properly latched? Most of the areola and your nipple should be in the baby's mouth, and your baby's mouth should be flanged out like a fish, and you should hear the swallowing sound, okay? That way